I could go on, but I'm not, because we have some amazing speakers here today. We have a number of folks to represent all of us. And without further delay, I want to introduce one of our champions in the United States House of Representatives, New York Congressman Jerrold Nadler.
Thank you. Thank you very much. Let me begin by thanking Planned Parenthood and the dozens of other organizations represented here today, and all of you who traveled from around the country to have your voices heard on these two important issues, which are really parts of one issue. The two issues being health care for all as a right, and reproductive freedom for all as a right. I hate to admit this, but 39 years ago, in March of 1970, was the first time that I went to the state capital of New York in Albany to lobby. And what I was lobbying for was to repeal the old anti-abortion legislation to get choice on the books, and we succeeded. The first completely pro-choice law in the country, as far as I know, and they proceeded and perhaps helped bring about Roe v. Wade 3 years later. If anyone had told me then that 39 years later we'd be fighting the same fight, that we wouldn't have been finished, I would have been very depressed. We fought a lot of other fights, but this one is not over. But it is winnable, and we must win it. The only fight that's been going on longer that I can think of is the fight for health care for all. That one started with Bismarck in 1890, really, I think, and is still going on. In Europe, they think it's old hat, and here we don't. We've got to win that fight too. But we cannot compromise one for the other, because they're two sides of the same coin. So we must demand and insist that a good health care bill pass, and a good health care bill without the Stupak Amendment or anything that looks like it. I don't have to tell you. If I did, you wouldn't be here. So I don't have to tell you what the Stupak Amendment is or how harmful it would be if passed into law, and how far removed it is from what they pretended to be, namely a simple extension of the obnoxious Hyde Amendment. It is not a simple extension. It goes way beyond it, and you know all that. We have a very interesting political situation. The Senate is going to pass, we believe, a health care bill. They probably will pass it without a Stupak Amendment in it. I say probably, but that doesn't mean you don't have to talk and insist every senator, but probably. Then it will go to conference between the House and the Senate. The House conferees, the members of the conference committee from the House, will be people who desperately do not want the Stupak Amendment. That I can guarantee you. But they will not be able, in their opinion, probably, to eliminate the Stupak Amendment in the conference unless they are confident that if the bill comes back, the conference report comes back to the House, that we can pass a health bill on the floor of the House without the Stupak Amendment. So our task really, after making sure the Senate does what we think it probably will do, is to make sure that the House members, even some of those who voted for the Stupak Amendment, especially those who call themselves pro-choice, who held themselves out as pro-choice in the last election and voted for the Stupak Amendment, we have to make sure that the message to them is, you can be forgiven. and only if you make it very clear to the leadership of the House and to us that you will vote for a health care reform conference report without the Stupak amendment. And if you don't make that clear, and anyone who doesn't make that clear will not be forgiven. Not now, and not for a long, long time. Because this is one of those seminal moments. This is one of those moments that come along every few years when a lot of things are at stake. And I'm a professional politician. I've been in public office. I've been in the State Assembly and Congress for 34 years. And I know when you have to compromise. And I know that you judge people by how tall they stand up for principle or when they compromise and so forth. And I can be very tolerant of people who have to compromise on some things, not on this. And that has to be the message that we communicate to everyone who ever wants to run again in our various states with any kind of support from the people in this room or from our friends. You may have made a mistake. People are human. Now, no. Not again. And if we deliver that message properly, and if we deliver that message with sufficient energy, we'll be able to get a health care bill that we can believe in, and that doesn't interfere with the basic human rights of women or anyone else. Thank you very much.
Bravo! Thank you, Congressman Nadler.